Good to have you with us.
Hello, Josh Spring from the Greater Cincinnati Homeless Coalition. As you probably know, we are the collective of 60 different organizations throughout Hamilton County, and we attempt to be the political voice of those 60 different direct service providers. So homelessness is a systemic problem that should not exist. And thus, in the midst of something like a pandemic that we are all experiencing, people experiencing homelessness and poverty and housing insecurity bear the burden more greatly. So we have been, since the onset of this pandemic, we have been coordinating with all of our shelters and our congregate housing providers. The first step that we took was to notify the city of Cincinnati that while we're all being encouraged and eventually ordered to stay home, to social distance, that those actions are not possible in a shelter setting. A person is not able in a shelter to social distance even while sleeping. And, and so therefore we called on the city to set aside space for a quarantine zone so that if individuals have COVID, they could exit the congregate shelter and be in this quarantine zone. And we worked closely with Kelly Carr in the city manager's office. And eventually we did get a quarantine zone up and functioning at the Over the Rhine Rec Center. And that locality can serve single adults. And so the way that it works right now and has been working for the last couple of months is if a single adult is tested by a medical provider for the virus, and once somebody has been tested, they are supposed to go into quarantine. So if that has happened, then, and the person says, I don't have a home to go to, then the medical provider is to contact the city's health department, which then initiates the process of transportation and intake to the quarantine area. Inside the quarantine zone, we have 10 by 10 pipe and drape living quarters with a cot and a lamp and electricity. And we have that on two separate floors. So people who are waiting their test results are on one floor, and people who have tested positive are on the other floor. And it is staffed 24/7 while people are there by nurses, two nurses who in non-pandemic times would be school nurses. And so that has been functioning, but it did not provide an answer for families. We have 4 family shelters that operate within our city and county, and we began looking at the potential of moving people in congregate settings out and into hotel rooms. And the need for this came swiftly. One of our single adult shelters early on, before processes were fully instituted, was released from a medical facility, having been tested, having been told to quarantine, but was sent back to the shelter with no notice, thus meaning that potentially everybody in that shelter had been exposed, and now everybody needed to quarantine. The same thing happened at one of our family shelters. And so the need to move people out of a congregate setting and into individual rooms became all too clear, because even if we get somebody who has been tested or has come back positive into the quarantine zone, it's kind of too late for everybody else. So at this time, our many member organizations, our shelters and congregate housing providers and medical, we were meeting every day of the week. And thankfully, the United Way and Greater Cincinnati Foundation heard our call for assistance and quickly provided funds for both the family shelters and the single adult shelters, such that we could move people into hotel. And so all of our family shelters are and have been operating out of hotels. And a significant portion of our single adult shelters have been operating out of hotels. So right now we have approximately 400 people in hotel rooms throughout the city. That's about half of folks who would otherwise be in shelter. And that created space for those remaining in shelters to spread out and better do social distancing. It has been really excellent. Sometimes you hear, kind of political naysayers say, well, we've got too many nonprofits and they overlap each other, or, something like this. And in fact, it's been really excellent to see how well our many member organizations have work together, as they do typically, but even more so in the midst of this crisis. Constant calls every minute working on COVID, and they've gotten a lot done. Moving 400 people in about a week's time takes a lot of effort, and they did it. And so since then, we have been working to design protocols within our shelters. We have been working to secure funding, to understand federal funding that's supposed to be coming for this. And we know that as everybody knows, the federal government, Congress passed the CARES Act. Within the CARES Act, there were in total $4 billion to be disseminated through what's called Emergency Solutions Grant, which is typically used for an annual allocation of funds primarily for the operation of shelters. And of the $4 billion, initially $1 billion was to be allocated, and of that, $3.5 million to our city and $1 million to our county. And the county has been an excellent partner. They quickly did the legislative work necessary to receive those funds and to allocate them once they get here. They allocated 500,000 of their million to shelters for the hotel and motel operations, and they allocated half of it, 500,000, to rapid rehousing, which is an opportunity for folks who have recently entered homelessness to exit and get into housing if there's housing available. The or the county, and I believe that is true in most parts of the country. HUD, one place for advocacy that anybody listening or watching could do would be to contact certainly your area's representatives, congressional representatives, and also send message to HUD Uh, they very much, if the COVID dollars didn't have, the word emergency connected to them, you certainly wouldn't know they were emergency dollars based on HUD's speed, because the dollars are still not in our communities, even though they were allocated 2 months ago. And what the county did, because the United Way funds that we were able to secure, we secured $155,000 from United Way and GCF for family shelters and $205,000 for single adult shelters, and those funds have really, for the most part, have dried up, and the county, thankfully, stepped in and allocated $600,000 in funding from the Indigent Care Levy, which is what, for the last month, our shelters have been using to keep operations going. The next step is the county's ESG dollars need to arrive to keep folks safe in hotel, and then the city ESG dollars need to step in. But at this point, another place for advocacy is with the city of Cincinnati. City Council has passed the legislation necessary to receive the funds, and we collectively have, through letter and through verbal communication, have told the city council, city administration, that those funds, once received by the city from the federal government, should be quickly disseminated to our shelters, because in a real way, our shelters have already spent much of those funds. So to put that in context, the hoteling cost in total for a month is about $800,000, which is very covered by the funds that we currently have, the United Way, GCF, and Indigent Care funds. So right now, shelters have only had the money to cover the actual cost of renting space at the hotels. So the increased cost of transportation and food and staffing, because it takes, many of our shelters lost a lot of their employees due to COVID, a lot of their staff, and so have had to hire temp staff, have had to pay overtime, and those are not covered by the funds we have now. But ESG should be able to cover those. And the city, unfortunately, has not, at this point, despite it being, I believe, just about 30 days since council passed the necessary legislation to receive the funding, the city has not said how they will allocate the dollars. There is a clear way to do it. There's only certain expenses that these funds can be used for, which is primarily shelter. And the city has indicated that they are working to try to figure out what city costs they can cover with these ESG funds. And we're confident that the only costs that could be ESG, Emergency Solution Grant eligible, would be the costs for the quarantine area. And so while we as a collective have said to the city, really, you should disseminate all of it to the shelters, that's who this is meant for, we have said, look, if you want to take time to figure out what of your costs, like the quarantine area, can be paid for, don't hold up the whole amount while you do that. So we've said, release of the $3.5 million, release $3 million, and hold back $500,000, figure out your costs, and then release what's left. And we've said that because the money has to get out. As soon as it gets here, it has to get out. And we know that there's no way that the quarantine zone costs anywhere near 500,000. So it would give them plenty of room to work. But despite that, they still have not indicated how they will disseminate it. And some may say, well, the funds haven't arrived yet, so why would they? But the reason they would is because typically the hands of government move slowly. And when the money gets here, there needs to be a plan so that it quickly gets out, so that folks don't have to return to a congregate setting. Because what we believe what we're doing in Cincinnati and Hamilton County is working. As of now, we have not had any outbreak in our shelters. We have not had, while there's been very little testing, so this is nothing scientific about this, but we have not had people in our shelters test positive for COVID. And other communities, other municipalities across the country have had significant outbreaks in their congregate shelters and have had concentration of deaths as a result of that. And thus far, we have avoided that in Cincinnati and Hamilton County. And we think that it is because we quickly deconcentrated our shelters. But the only way that we can keep that going is with the funding that is allocated to it. And so the question that, outside of kind of advocacy around the funding and all, our organizations, for more than a month, we were meeting 5 days a week, and then 3 days, and now we're meeting 2 days a week, and meeting regularly with our family shelters and also our congregate housing, so treatment facilities, group homes, and reentry facilities. And we have formed a subgroup that we're calling the Future Subgroup, and we're attempting to answer a handful of difficult questions. The first question being, what will be the trigger that will tell us it's time to go back to congregate shelter? The second question is, what should, for places that are treatment facilities and the like that are still doing intake, what does responsible moral intake look like right now? So to put that in better context, if you're a provider of addiction recovery housing, addiction, of course, is continuing. And so your mission says you need to be taking people in. But many of our congregate housing folks of necessity have decreased their census in order to create space for quarantine in their facilities. And so as a space opens up, do you take somebody in? Do you test them before they come in? But then the test is only good for that moment in time. So how do you do that and still offer your services? And then the third main question being, how can we utilize various federal funds that are coming, whether it be ESG, as I've talked about, or FEMA funds or community development block grant funds? How can we utilize those for longer term results? So for the first question, what we've done is we've put together a very in-depth survey for our many shelters and congregate facilities, and almost all of them have filled it out at this point. And so the questions are about current operations in shelters and congregate housing capacities, and physical attributes. So it's really, the kind of detail that we're getting into, for example, is, how many bathrooms do you have? and how many toilets are in those bathrooms, and of those toilets, how many function with by motion. You don't have to touch anything. How many of your faucets function by motion? How often do you clean your showers? What would it take to clean them more often? And many questions of that regard, so that we can come out with answers of, what would it take to make our congregate facilities safer and less apt to promote the spread of the virus? How can we decrease the amount of places that people, objects that people touch? And what would it cost to do that? And where can we get the resources? And so, the next step will be prioritizing those changes and seeing how much of it we can do, because probably at least a part of the answer to the question of when should we go back is, when can we make the places safe enough to go back? Not to say that any of our shelters were unsafe prior to the pandemic. It's a new definition of safe now. And we are also talking about health screenings. So getting an idea of what our agencies are doing in terms of health screening at intake, and then also daily health screenings of staff and clients. And majority of our agencies are doing health screenings, almost all at intake, and are doing some form of health screening on a daily basis for everybody. And so how does testing play into this? The National Healthcare for the Homeless organization did a webinar a short time ago. They had, amongst other people, they had folks on there presenting from Boston. And some of you may have read reports from a large Boston shelter that they did 100% universal testing of folks in that shelter. And I believe it was 36% of people came back positive who were asymptomatic. So there was no sense that they had the virus, but they did and were potentially spreading it. And what the group out in Boston did is they used one of these predictive models and plugged in four different interventions in the shelter setting, looked at the results 4 months out to see how each intervention performed. And the intervention that they believe overall, from a financial standpoint, and most importantly from a human life standpoint, is to do universal 100% testing at congregate facilities every 2 weeks. And when somebody tests positive, to quickly move that person into what they're terming an alternative care site, which in our case would be the quarantine zone or a hotel. Them there until they have become symptom free for the requisite amount of time, and keep testing. And this would be true. So not only testing clients every 2 weeks, but also staff every 2 weeks. And one of the questions that I and others asked was, once somebody exits this alternative care site, what about reinfection? And the answer, there really isn't a great answer to that, other than everybody should be wearing masks, everybody should be cleaning surfaces, and all those things that we're told to do. And so reinfection likely would happen. But if we are every 2 weeks moving out people who are carrying the virus, we will over time decrease the threat within the setting. And they also recommend that if there's an abnormal uptick in positives at a particular facility, or say in a particular neighborhood or zip code where that facility is, that you increase the regularity of testing there. Maybe you first go from 2 weeks to every 10 days. But all of that, well, it's, at least I found it useful, because it was the first kind of predictive recommendation that I had seen relative to the world of homelessness. And but you've got to have the tests to do it. It takes a lot of tests. We're talking probably around 2,000 people every 2 weeks, when you include staff. And so where do the tests come from? Who processes them? How do you get them turned around quickly? And certainly you've got to even increase the ability to move people into hotel, depending on the number of results that come back positive. The Cincinnati Health Network, one of our longtime member organizations, has certainly been a rock through all of this for our organizations and agencies and for ourselves. And so they have been doing some testing. They are working on figuring out how to do more testing and more efficiently. And then in terms of the question of long-term, what some communities have done, and we think that it makes sense for us to look into this here, is at some point we may have spent, or at some point we probably will have spent enough money on hotel rooms that we could have just purchased a hotel. And so maybe we should purchase a hotel, and do what some other communities are also considering, buy a vacant hotel with some of these federal funds, utilize it as we're utilizing hotels now. Once the pandemic ends, convert it into affordable housing, so that it lasts for the long haul. So those are longer term ideas that we are considering and need to track down. In terms of the operations of the Homeless Coalition, for the past now 25 years, we have operated our newspaper, Street Vibes, which comes out every 2 weeks, and is distributed by about 50 different folks, not always the same 50 folks, but about 50 people who have experienced homelessness or currently are, or experiencing housing insecurity. And we, early in this pandemic, we like street newspapers across the entire globe, we had to cease our street distribution of the paper because we knew, one, there weren't going to be many people out and about to buy it, and two, the virus could be spread on the paper. You can't really hand somebody a newspaper and stand 6 feet apart unless you've got really long arms, I suppose. And so we had to end that. Certainly the first time we'd ever done that since the inception of the paper. And that, for us here and for papers around the world, has a significant impact on our many distributors. Our distributors rely on the income from the newspaper to make ends meet. For some folks, it might pay the rent. For other folks, it might bridge the gap between the other income they have, and making the rent, or buying the quantity of food they need, or medicine, or anything else. And so it is significant. It is also significant in that the paper is a part of our mission to disseminate information about homelessness and poverty and housing, to advocate in a way that doesn't happen in the commercial press. Uh, and certainly that's important to our organization, and it's important to each distributor that is doing the work. And so what we have done, and are still doing, is we've been attempting to get people to subscribe to the paper. We've for years we have done hard mail subscriptions, and so we've tried to increase that. But we've also introduced online subscriptions. Somebody can subscribe online and get the paper digitally. And our plan is to use the funds that come in from these added subscriptions or Street Vibes donations, is use that money to eventually disseminate amongst distributors. And at this point, that won't make up for it probably won't come close to making up for the economic loss that they've experienced. But it's kind of the best that we can do. And meanwhile, Gabriella, our editor, is in conversation with papers across the globe that are collectively trying to figure out, similar to the shelter question, when and how do we eventually get back to street distribution that we rely on. So if you are interested in getting either a hard mailed copy or a digital copy, you can visit the Homeless Coalition's website, Cincy, CINCI, homeless.org. You can also find Street Vibes on Facebook and get there that way. And I will also just add, so right as this pandemic struck heavy, we were kicking off our campaign to collect signatures to put the funding of the Affordable Housing Trust Fund on the November 2020 ballot. In fact, our big kickoff day was the March primary, which didn't happen. The March primary didn't happen, nor did our kickoff. And so in order to hit the November primary, we needed to collect just over 12,000 signatures by mid-August. And it has become clear to us and the committee that's working on this that that's not a feasible task, given our current situation. And so we have decided to move our goal to the May primary of 2021. So we are currently figuring out what a petition drive in the middle of a pandemic looks like, but we have given ourselves more time. You can stay tuned, because we are launching a website under the name of Cincinnati Action for Housing Now. We will also be launching Facebook and other social media. I can't think of the names of all the social media, but we'll be launching those. And we've got there's a phone application brought to us by Center for Community Change called Outvote that you can download on your cell phone if you have a smartphone, and you can sign up for our campaign. It's already on there, and then you will get directly to your phone information about what we are doing, and you'll be able to forward that to the contacts in your phone. So it's a new way of digital organizing. And we're going to be spending a good bit of time, and we could use everybody's assistance with this, at collecting stories. So we believe that the funding for the trust fund has been needed for a long time, but it's certainly needed now more than ever. So many families and individuals are out of work, either because they've been laid off or they can't go to work because their kids are at home, and so it's needed now more than ever. And we are going to be working to collect the stories from organizations and individuals about their own struggles with homelessness and housing insecurity, especially in the midst of this pandemic, collecting information from people and groups about why they support the Affordable Housing Trust Fund, and gathering that together to disseminate out online and provide context and education for the general public, um, and so that as we're able to roll out new ways of collecting signatures, and when we eventually get to pushing for folks to come out to the polls next May, we'll have more supporters, because folks understand the reasons why. And so stay tuned for that. If you are interested in more information, you can sign up for our email group on our website, again, cincyhomeless.org, and we will keep you up to date. And then the last thing that I'll add, which I forgot to say earlier, because of the pandemic, we have already seen a significant increase in the number of people living outdoors. Early on, our Daily Bread, which is our area's largest meal provider, saw a 113% increase in the number of people coming there to access meals on a daily basis. And I believe that it's even higher now. Numbers like pre-pandemic of 150 meals a day to now over 400. And street outreach workers are showing significant increases. And we think part of why that happened and has happened is because of our shortage of housing. Many folks are doubled up living with friends and family or even strangers. And as the pandemic hit, certainly fears around having people in close proximity to each other, as well as less money to sustain a larger household, people were turned out. And so we don't know the exact numbers, but it is probably higher than we've ever seen. And we've advocated for access to clean water. Waterworks has provided 2 clean water spigots, which is good that Waterworks did that, but certainly is not enough. We have used some of the funds from United Way and Greater Cincinnati Foundation to rent portalettes and hand washing stations that we've placed at specific locations in the city, in the Queensgate area near the main public library, and our Daily Bread, and the Mary Magdalene House, and the Shower House. And thankfully, after a month of having to be closed earlier this month, the Mary Magdalene Shower House was able to reopen, because before that, folks outdoors hadn't been able to shower in probably a month, which would be terrible in the best of times. But the folks, staff and volunteers at the Shower House have worked hard and have reopened. So with that said, let us know if you have any questions. You can go to our website to figure out how to contact us, and please reach out to HUD and the city, and tell them to release the funds. Thank you.
Well, thank you, Josh. And this is the first effort to do one of these live streaming. And we were so fortunate to have Josh with us. And it just shows when you have an inequitable situation to begin with, the hardships that brings